We're here today with Dr. Sam. With Dr. Sam?
Yes.
Great.
I have a doctorate.
Good. With Dr. Sam Mingy, one of the psychologists at North Medical Clinic. And can you just tell us a little bit about yourself? What attracted you to psychology and what are your areas of interest?
So I originally studied law after I left school. Went on to study IT, didn't finish either of those, sort of bummed around a bit and wasn't quite sure what to do with my life, and decided somewhere in there that I wanted to help people. So I enrolled in psychology and never really looked back, I guess. So I went on to get a doctorate in clinical psychology. That was about 10 years ago. Since then I've worked in a bunch of different settings, and I just kind of like helping people, really. I like listening to people. My areas of interest are pretty broad. Depression, anxiety, relationship problems, addiction. I guess anyone who's struggling with life.
And now, Sam, can you just tell us what is a mental health plan?
Yeah, a mental health plan is a plan that is developed between you, the patient, and your GP, which allows you to have subsidised through Medicare psychological treatment with a psychologist.
And how many visits does that mental health plan qualify you to have?
The initial care plan allows you 6 sessions, and then at the end of 6 sessions, if you'd like to continue, you need to go back to the GP and get another letter for the extra 4.
And who qualifies for a mental health plan?
Anybody really. You need to have a diagnosable mental health condition and some kind of goals to work through, which can be quite simple. I mean, it might just be for your mood to improve or to feel better. And the diagnosable mental health condition is quite broadly defined as well. It would be unusual that someone would go to get a mental health care plan and the GP say, you're not eligible.
Yeah.
If you want the help, it's available.
And under the mental health plan, can I choose my own psychologist?
Yes, you can. I guess it's a fundamental principle of our healthcare system is that you can choose your healthcare providers. Often when you get a mental health care plan, it will be referred to somebody, but you are allowed to take that mental health care plan to any psychologist and receive treatment under it.
And can mental health care plans be completed or performed over telehealth?
They can now. They weren't able to be until recently, but with the new COVID Medicare items, yes, they can.
How common are mental health care plans? Like, do many people have them or?
Very common. I couldn't tell you the stats. What we do know is that 20% of Australians, roughly, per year, would be diagnosable with some kind of mental health condition, typically depression or anxiety. So mental health problems are very common in today's day and age. And so I would imagine that mental health care plans, a lot of GPs work these days would be talking to people about mental health concerns.
Yeah, absolutely.